People are losing weight with GLP-1 drugs, but for some, within weeks, their face starts to change. Not just slimmer, but thinner, older, and looking unwell. That's the moment people pause, because something doesn't feel right. You look in the mirror, and for a second, you don't quite recognize your own face. Flat cheeks, hollows under the eyes, looser skins around the jaws, almost like you've been through severe illness. Some people have started calling this the Ozempic Face, and for some, that one change is enough to flip the whole experience, from enjoyable progress to concerning doubt about where this is going. I am Dr. Almerie, weight loss surgeon and obesity specialist. In this video, I will show you the biology driving these changes, who is actually at risk, and most importantly, what you can do to manage it so you move from guessing to being in control. Let's dive in. Now, this is where most people get confused, because the assumption is the drug is damaging your face and that it is somehow accelerating aging. And when you see these changes to your face, that thought feels real. Am I harming myself? Now, there is a part of this that feels true, but not in the way people think. Because when fat loss happens, you don't choose where it comes from, and that includes your face. What you are losing is not just fat, you are losing structure, the volume under the skin which supports the face and how it looks. And when that volume drops, the face doesn't just get slimmer, it changes shape, like you've aged years in just a few months. And here's the key idea: your skin is not designed to shrink perfectly with volume loss. It adapts, but only up to a point. So when that support under the skin drops quickly, the skin has nothing to hold into. And that's when it starts to show thinner but older. Now, this explains why it happens. But the question is, why does it look worse in some people? Because two people can lose the same weight and look completely different. One looks healthier, the other looks suddenly older and deflated. Same process, very different outcome. And now you are probably thinking, which one will I be? Well, that depends on where you sit on the risk spectrum, and this is where it becomes predictable. Let's go through that next. So why does Ozempic Face hit some people harder? Well, that is not random. There is a pattern, and once you see it, you can easily place yourself on that spectrum. Now, here's the key point. This is not about one factor. It's how different risk factors stack together. But not all of them carry the same weight. Two matter more than anything else. The first one is how fast you are losing weight, because your body can adapt, but only up to a certain speed. If weight loss is gradual, the skin has time to adjust. But when it is fast, the volume drops before the skin can respond. And that is when it shows. The second factor is about your starting baseline structure, because not everyone starts from the same place. Some faces have more volume, more natural support. Others start lean with less supporting volume from the beginning. So when that volume drops, it shows much faster and often more dramatically. Now, on top of that, you got other contributing factors. Your age, because this is not just about weight loss. It's about how your body responds to it. In your 20s and 30s, there is more elasticity in your skin, so naturally, more recovery. But as we grow older, the same weight loss can look very different. And finally, your skin quality. Because when volume drops, some skin adapts, others don't. Elasticity is already damaged by long sun exposure or long history of heavy smoking. So now you are probably starting to see where you sit, because this is not just one factor, it is the combination, and once you see that, you can clearly define your risk. But knowing your risk doesn't change it. So the real question is, what do you do about it? That is where things become practical, and that is what we will explore next. Now, this is where it matters most, because at this stage, you have three options: ignore it, slow it, or correct it. And what you choose determines how far this goes. Let's keep this simple. First, control the rate of weight loss, because when fat drops, support under the skin drops with it, and your skin needs time to adapt. If your weight loss is controlled, the skin keeps up. If it is too fast, that support disappears before adaptations happen, and that is when it shows. Second is your nutrition, especially protein and micronutrients like iron, vitamin B12, and zinc, because when these drop, your face doesn't just look thinner, it looks depleted, less color, less vitality, less presence, and it shows. Third, protect your skin, because skin quality plays a major role in how your face looks during weight loss. So first, reduce things that accelerate skin damage. Avoid unnecessarily long sun exposure and avoid smoking. Then focus on improving skin resilience. Topical treatments like retinoid creams have been shown to improve skin quality because they stimulate the skin's natural collagen production. Moisturizers can help as well, mainly by improving skin hydration and the surface appearance of the skin. Now, even if you do all of that right, if your risk of Ozempic Face is high, you may still see changes that don't match what you expected. And this is where most people get stuck, because now you are thinking, things still don't look right. Is there something else I can do? And this is where aesthetic treatments come in. But it is very important to understand these treatment options because they should not be used randomly. Aesthetic treatments solve very specific problems. So first, you need to understand what the problem is and get the diagnosis right. And then, and only then, you choose the treatment that matches that specific issue. This should always be done in discussion with your treating doctor. So let's discuss the two key aesthetic approaches your doctor may suggest. The first option is volume replacement, because for many people, the biggest change is loss of fullness under the skin, and this what creates that hollow, drawn appearance. Fillers can be used to restore some of that support. In areas like the cheeks, under eyes, jawlines, they help restore structure and soften that hollow look. Another option is fat transfer, using your own fat to restore volume in a more natural way instead of the fillers. But sometimes the change goes further and it is no longer just about lost volume. This is when the face itself has started to shift downwards. The skin becomes loose and excessive, and this is where facelift surgery may become an option, because now the goal is not simply adding volume, it's repositioning that deeper tissue back upwards, reducing all that kind of downward pull. Obviously, these are advanced options, usually only reserved for more significant changes, but understanding how these treatments work is extremely important because it allows you to have a much more informed conversation with your doctor instead of guessing. Now, if there is one message from this video, it is this: you are not damaging your face, you are losing support, and that is what changes how it looks. Now, how far it goes depends on your risk. When you lose weight, you can't control where fat comes from, but you can control how fast it happens and how it shows. So instead of reacting to what you see, I want you to understand it and stay in control. Now, one of the other changes people notice with GLP-1 weight loss is hair loss. And when that happens, it can feel worrying, frustrating, like something is going wrong. If you haven't watched my video on that, I recommend you watch it next. I break down why hair loss happens, what's actually driving it, and how to stop it so it doesn't undermine your progress. I have linked that video up here. I am Dr. Almerie. Thanks for watching. I will see you in the next video.